everyone, welcome to Compassionate Therapy's first YouTube video. And I've been inspired to create these because I've been getting a lot of inquiry emails from my clients, and I thought this might just be a really great way and a really useful resource for explaining what therapy is, how it works. I'll be talking about all sorts of different kinds of interventions, I'll be speaking to other therapists, and I'll be looking at case studies and how it helps. So I am working from a PowerPoint presentation, and I will hopefully integrate it into this video so that as I get to each slide, it'll pop up on the screen. So my name's Emma, and this is Compassionate Therapy. My background is in civil service and complex care, and I know how traumatic daily situations can be. So I've created Compassionate Therapy to be able to share healing techniques and promote self-care through everything that I have learned on my own healing journey. So my background, I have 20 years in self-healing and alternative practices, starting off with interest in using them on myself and then getting trained to be able to bring them to others. 10 years working civil service, so I started off in immigration and then I moved into the more business side through the British Geological Survey. And here, this was back in the late 90s, early 2000s. I experienced a lot of training regarding self-management, time management and diversity in the workplace. And this was a great sign that we're all moving in that direction. I then changed my career path. I have 10 years in complex care. This was private care, personal care, and also in people's own homes through social domestic care. I work with people of all age groups, all different mental, physical disabilities, helping them live independently from dementia all the way through to problems like motor neuron disease. And here I connected with family members and collaborated with other healthcare professionals, and I began to realise what is needed and the strains and pressures, not just on a personal level but also in the workplace regarding care. I have 15 years learning meditation. I'm also qualified to teach, and this was a foundation for me moving into the therapy field. And I have 12 years in alternative and holistic care. This is ranging from crystal healing to Reiki, and 10 years in massage therapy. I still believe that all of these aspects are a really important part of holistic healing. I love everything that I've done up to this point, and I've spent the last 2 years training in clinical and medical hypnotherapy and psychotherapy because I'm fascinated about learning the psychology behind therapy and conditions and how that all connects together. So I work with all age groups ranging from 5 years old up to 89 years old. I engage in weekly training sessions and business development. I'm always keeping up to date with policies, procedures, interventions, and expanding my knowledge for myself and also to be able to share that with others. I run my own website, blog and newsletter, and now these YouTube videos, which I will be integrating together on weekly topics, so it all connects up and it gives people as much information and resource as possible. And I work to a very high standard of safeguarding and code of ethics. I'm an independent therapist, and I'll be covering a little bit of that a bit later on. And fundamentally, I'm offering trauma-informed therapy and support to all cultures and all diverse individuals. I think this is so important within all of community and all of society. So why compassionate therapy? Well, I want to create a safe haven that's built on trust. And it's created by choice, bringing people together to gain back your power. After the stress of working in office-based roles for the government, I changed my career to be of service to others. Initially, I focused on alternative holistic healing, which naturally has progressed on to learning the psychology side of therapy. So as I mentioned previously, my experience and my background has been office-based, also in the care industry, and I went through the education system. I have 3 children. So this is what drives me to bring this collaborative healing, because it's so important in the workplace that we make the changes that we need so people can heal. Individual healing is really important, but we're also affected by each other. At the moment, there's all sorts of stories in the news regarding schools, teachers, students, in the care industry, from the frontline staff. So my main aim through everything that I've been doing is to bring awareness, to bring collective healing so that we can break the cycles. And for me, it began with a lifestyle change. So after my experience in civil service, I took some time out to go travelling. And through this, I went to Thailand, I learned about Buddhism and meditation. I made a list of the things that I'd changed when I came back to the UK. And one of those was to do some volunteering. When we work and we're not worried about financial aspects or paying the bills, we open up our heart and we do something that's much more aligned with who we truly are. I volunteered for Leonard Cheshire Disability. This is residential homes supporting people of all ages with all different disabilities, and I absolutely loved it. I was a befriender, I started art therapy clubs, I learnt to drive the minibus, and I just connected with my local community, taking the residents to church or days out or whatever they wanted, and it really did make me realise that care and being a service to others was definitely it for me. I also joined the Buddhist Nottingham Buddhist Centre, where I learned about Buddhism and meditation, and this led me into finding alternative ways for healing myself, and then being trained to be able to bring it to others. And from this, compassionate healing was born. So before I started going into the psychology of therapy, I offered healing services to do with massage and energy healing. So for me, healing is an evolution, and it's sparked from my own personal experience. When my daughter was 10 years old, she had some emotional ups and downs. So I tried her with some hypnotherapy, and it was incredible. It was so incredible. I kept in touch with that therapist, and we connected really well. And 10 years later, she then became my trainer. So I did my initial psychotherapy and clinical medical hypnotherapy with her. And it's changed my life, and it keeps progressing more and more. One of the things I began to learn is life is traumatic. So no matter who you are or what you've been through, even if you think you're absolutely fine, life is full of trauma. And this is on different levels, and it affects everyone in different ways. Even the birthing process is traumatic. So even if you've had an amazing birth, there's still a lot of physical and emotional changes that occur. And what I'm trying to do here is I'm just trying to raise the awareness and normalise it so that we're all better equipped to help each other. I consider myself to be an intuitive healer. So the way I would describe it is it's an inner voice, and despite my efforts in other careers, I just had this longing, and I was always drawn towards being of service to others. And through having that time out and changing that, I've begun to realise that I'm a people person. I love listening, I love connecting, I love problem solving, and I also love to make people feel good about themselves, no matter who they are or their backgrounds, and what they're dealing with. So it was natural for me just to move on to learning about the psychology behind the symptoms. And there is a profound mind, body, soul connection. And in the holistic healing, we need to address all these parts of ourselves. It's fundamentally important. And healing never ends. We're always moving forward, we're always evolving in our lives, and therefore the healing moves with it, no matter whether it's physical, mental or emotional. And I love helping people connect with this part of themselves to realise exactly, which areas they need to work on. And learning about healing leads to more healing. It is a rabbit hole, and I've definitely fallen down it, so it's constantly evolving for me. And since I've become aware of trauma-informed therapy, it just makes perfect sense. And I'll be going into more detail about exactly what that means, but fundamentally it's a bigger picture. It's a higher awareness. It's being patient and listening, treating everybody individually, and realising that sometimes therapy just takes something deeper. It also means that we have to share this knowledge and this awareness, because we all affect each other, even if we don't realise it. On a collective level, trauma-informed therapy is so important. And it's a collaborative and holistic approach. So it's integrated into all the systems, all the bodies, whether it be government, schools, NHS, charities. It's really important that we're all listening to each other and we all have this higher perspective to help us all be able to heal together and individually. Compassionate therapy is completely 100% inclusive. So I work with people of all cultures, genders, ages, sexual orientation, ethnicity. I encourage all dimensions of differences. It's really important to me, and what I'm trying to do as well is normalise problems and behaviours, because at the end of the day, we are all human. And if there's anything about you that you want to improve, or you want to heal, or you want to change, I really encourage people to step forward without shame or guilt, because this is evolution, and we all need to move forward. We all need to help each other. We all need to be human and to express that and find ways to heal. And again, collaboration is just so important to me. I really do and want to do more work integrating into schools, corporate organisations, companies, charity, residential homes, government bodies. I want to help people, staff, students, teachers. I want to help them heal themselves, but also heal others. There's a lot of tips and techniques that you can use, and awareness is the key. So I'm always here to talk and answer questions. And if along the way you do have any questions about this video or any videos moving forward, please do comment or send me a message, and I can integrate that into these videos. So the therapy on offer with compassionate therapy, I qualified in clinical and medical hypnotherapy and psychotherapy, which naturally led onto learning more techniques, and this never stops. And I'm pleased to be able to share these with others, to give more information and promote choice. And over the next few weeks, as I mentioned before, I'll be going into more detail regarding how various therapy interventions and all therapy offer, how it works and how it can help. And the way I work and everything I do is all on a trauma-informed basis. I work to high levels of collaboration with a holistic approach to therapy for all. So in my assessment, I want this to be a really valuable first connection. And for me, your safety is of highest importance. So I don't provide long forms for you to fill out, and I don't ask you lengthy questions. I get to know you on a client needs basis, and this is going to be completely individual for everyone. So I'm here to listen. I'm also here to guide you, and I don't want you to feel overwhelmed. I don't want you to feel threatened in any way. So I will listen, and I will identify, and I will discuss with you what I feel are your multiple or complex needs. And we just take it step by step. I want you to be physically, emotionally and psychologically safe. Even if it's online, I want you to know that you are in the driver's seat. But also I don't want that to intimidate you either. We just take it bit by bit. One thing I definitely want you to feel is an improvement in your mood, in your safety and in the way that you feel after the first session. And how do I go about that? Well, as I say, every client is a complete individual, but I want to help you. I want to reinstall hope through setting goals that are achievable, for making you realise how powerful you are. And I set clear professional boundaries, but I also will encourage self-soothing techniques to practice from the very first session, because you're not going to be with me 24/7. And I think it's really practical to have those in place before we finish the first session, so that even when you leave there, you know how to be able to manage yourself should anything occur. The interventions I use are all evidence-based, and I focus on your strengths. So another really important part of the way I work is that you have choice. So I offer several interventions, and I invite you to intuitively pick whichever you think you're drawn to. And if perhaps there's something that maybe you're not interested in straight away, we might come back to that at a later date, because the healing journey is all about change. And as you change, you become stronger, you become more empowered, and things that perhaps would be intimidating for you at one point, soon you can invite into your life. So that's great. This is a collaborative experience, and your choice is fundamental. So what I want you to be able to self-regulate. And I will integrate this into your treatments with fun activities. So it's a very, very, very subtle but yet fast working session for you, so that you feel good and you feel safe. And what outcomes do I want? Well, I want you to build a resilience. Not only do I want you to build a resilience, but I want you to remember how resilient you are. You're a survivor. You've made it to this point. And that's incredible. And sometimes we just get lost beneath what's on the surface and we forget how powerful and resilient we are. So I want you to build on current skills, but I also want you to create new ones. You know, this is the beginning. This is something really exciting. And I want you to find yourself in ways that perhaps you'd never found before. I always review everything regularly, check-ins, even in one therapy session. I don't want to push you to places you don't want to go. And I also want you to realise that I'm a therapist. I'm here for you. I'm emotionally stable. If at any point you don't feel comfortable with anything that I say or any direction that we're going in, we stop and we breathe. As I've mentioned before, your safety is my priority, and I'm really, really, really steady with the way we move and the progress. And as I say, it's all down to you feeling good. And I want to help you to create a new life. I want your dreams to come true, no matter how big or how small. It's so exciting because I know it's possible. And I really do want you to realise something about yourself that you never knew. And we do this by connecting to your infinite inner resources. You know, I am a guide, but you don't know how powerful and how wonderful and how able to heal that you are. So we connect in there. Aftercare is really important to me because, again, I'm not going to be with you all the time, and I don't ever want to leave you without knowing that we have something firm in place that you're happy with, a support system, a network that you can continue and be consistent with in the aspect of self-care. So there's quite a lot of words in therapy that can be a bit intimidating, but in brief, I'm just going to go through a few. I integrate all of these into my therapy sessions, but obviously the idea is you don't realise it. So neurobiology is just all about explaining the science and the connection between your mind and body. And depending on your conditions or your behaviours or whatever treatment we're going through, I will completely and utterly normalise that for you. But I believe that giving my clients this information really helps them to better understand themselves. That they are not necessarily a diagnosis, that there's something going on behind the scenes, and that is ultimately what we're here to support and understand. Psychotherapy, well, in brief, that's what we do. We talk about what's going off, we analyse what's happening, we discuss ways around it, and we just get a higher perspective through the talking part of the therapy. Hypnotherapy, it's not as intimidating as some people think. It's just getting you into a really nice space inside of your mind where you're relaxed and you're comfortable, your conscious mind has stepped back, your subconscious mind steps forwards, you can hear me, you're awake, you're alert, but you're just deeply connected. I use something called idiomotor signals, and I have infinite amount of techniques in hypnosis if that's something that interests you, and it's a great way of getting right in there and connecting with your subconscious more directly. Neuro-linguistic programming, well, this is your map of the world, and your map of the world has been created by what you've heard, what you've seen, and how you've interpreted that. And what we do in these sessions is we identify and we can reset and we can analyse and we can discuss what is negative or what is limiting, and we can work around ways of changing that and resetting yourself using a few sensory activities. And again, there's loads of ways we can work with neuro-linguistic programming. Cognitive behaviour therapy, well, this is a lot of structures and frameworks about how you think and how that affects your behaviour. And again, all of these I integrate quite subtly into a standard therapy session. So I'm a massive promoter of green mental health, and the reason why I love it so much is because it's free. Green mental health is all about working with the resources and everything that we have as human beings on this planet, in this universe. So breathwork and meditation and mindfulness, journaling, relaxation techniques, connecting with nature. So it can be forest school, it can be animal therapy, it can be nature-based activities, looking up to the stars, discussing cosmology, finding out about how the universe works, philosophy, and going inside to that creative part of you that is directly connected. And this can be a passion and something you love doing, like creative writing, it can be cookery, just connecting with that spark of life. And other interventions that I offer They include the following, and as I've mentioned later on, when I go through videos specifically regarding interventions, I'll go into more detail about them and how they can help. So dialectic behaviour therapy, acceptance and commitment therapy, trauma-informed CBT, eye movement desensitisation and reprocessing, emotional freedom therapy, thought field therapy, havening, anchoring, somatic psychotherapy, and psychoeducation, to name a few. So again, a lot of big words there, but I'll break them down with case studies and look into the individual interventions and explain a bit more about how those work. So I offer one-to-one 60 to 90 minute sessions in person and also on Zoom. And I also offer group sessions over Zoom. These are usually 2-hour sessions. And this is a great way for building a network of support, for advice and discussions, and trying out interventions as a group if perhaps you're not sure whether you want to commit to them on an individual level. So how therapy can help. Everyone needs some guidance and understanding at times, and this is what therapy brings. And I want to break the stigma and bring the solutions so more people can have access to the knowledge of self-care and healing with therapy. Find something that inspires you and work from there. So on a physical level, we're going to predominantly look at the stress response. And this is something that happens inside of our physical bodies. It releases chemicals and hormones, and this really does send us out of loop. So we look at breathing, we look at your heart and lungs and the connection with your brain. And I teach about how we can re-empower ourselves to gain with tips and techniques to get on top of that. We look at your energy meridians. These flow through your body a bit like blood through your veins, and these are created by the electromagnetic pulses that are given off by your organs. Ultimately, this makes your electromagnetic field, and I'll talk about that more in detail when we come to that part. I look at the vagus nerve. This is the main nerve that runs through your body, and again, it really does have a connection with all of your other organs, and ultimately, we look at the sensory response. So in life, we experience something, whether it be sight, sound, touch, taste, and we carry that inside of us. And if it's a negative situation, we hold this and we're affected within our minds. And so ultimately, we try to reverse that by getting you into really nice states. A lot of the interventions I use are based on sensory experiences to reset and reprogram negative things. And again, I'll go into more detail explaining that with the individual interventions. And we talk about your physical symptoms. So pain, skin conditions, these can all be heavily tied in and connected with the stress response. And by learning how to control and how to manage and how to stay on top of your stress response is a great additional tool for healing. On an emotional level, I want you to feel motivated. I want you to realise that there is infinite possibilities for you to self-heal. I want to teach you how to self-regulate and be consistent with it and manage that. I want you to feel stable. I want you to feel less reactive. And I want you to be able to build up a tolerance to distress, because ultimately, through life, we're always going to come across things that are uncomfortable to different varying degrees. And when we learn how to tolerate our own distress, it's a really great tool for moving forward and healing and breaking the cycle of trauma. And I want to be able to reduce shame, guilt, fear, anxiety and anger. That's one of my main outlooks. I really want you to feel supported, protected, and as I've mentioned before, we're all human. So on a mental level, I want you to become independent. I want you to feel independent. I want to teach you about trance states. These are actually quite normal states of mind, but they can also really affect us when we're going through an experience. If it is a trauma, we can deeply harbour and hold that in. But we can also use our trance states to untie a lot of negativity. I want to give you coping strategies and mechanisms. So again, you're able to go forward and you're able to continue with the healing journey. I want to give you new ways of functioning and also restoring lost ways. Sometimes we get so bogged down We don't realise that we've had this great resilience and inner resource, and it's just got forgotten about somewhere in there. I want you to feel hopeful. I want to completely reinstall hopefulness. I want you to be able to see the value in everything, even learning from your mistakes. And when I say mistakes, it doesn't necessarily mean you've done anything wrong. It can just simply even be inviting the wrong kind of people into our lives. And again, that's something that we just have to learn as we grow. And socially, I want you to have better relationships, because if you have better relationships, everyone has better relationships. And this is how we build foundations for community. If everybody's more culturally aware, and bringing in the diversity, helping people manage their behaviour. When people can manage their own behaviour, they stop inflicting things on others that kind of can trigger other behaviour, and it's just working, again, collaboratively as a whole on a healing level. So energetically, I want you to be stronger in your mind, body and soul connection. Okay, I want you to feel less fatigued. I want you to attract better situations and relationships into your life. And again, this happens on an energy level because we're all giving off signals to one another, and we'll explain that in more detail. And it connects to our electromagnetic field, which is sparked by the heart that gives off the strongest pulse, but also our other organs are feeding into that. And if we're damaged in any way, all of this weakens or has blockages. And through therapy, you can learn how to release those and let them flow through your body. And by doing so, you just attract better situations into your life. And it's all connected to your mind and your body. I want to work closely with schools, colleges and universities, students, teachers and staff. Everybody is suffering collectively. When teachers have to take time off, when there's some sort of issue with students or staff members inside of an education unit, everyone feels the consequences of that. And by bringing this information into that environment, by raising awareness, by helping people to heal, by encouraging people to realise they have someone to talk to, this is part of my main aim. And knowledge is power. So when people feel lost and alone, this is when tragedies happen. And one of my ultimate goals is to really bring this awareness into schools for all people. It's the same in the workplace. Corporate, charities, organisations, frontline staff, residential and care homes. I want everybody to feel they're part of the same whole, and everyone needs to heal. Everyone needs to be supported. Everyone needs someone to speak to. Vicarious trauma, again, it's something that I'll explain in more detail, but everyone can be affected by someone's personal trauma. And sometimes they don't even realise it. You know, if you're in a position where you have to listen to traumatic stories on a daily basis, you feel like you go home and you can just switch that off. But it stays with us on a mental, physical and emotional level. And again, through compassionate therapy, I'm trying to bring this into the corporate world, bring this to organisations, bring this awareness to education systems, so that together we can break the cycle, because prevention is the key. And I always give lots of tips and techniques to prevent. And if you feel like you've perhaps been through something before on a mental health level, I want to prevent a relapse. Life is difficult, as I said before, life is traumatic. The only way, we can't stop bad things from happening, but we can help people. And the sooner people have a resource, a connection after a trauma, the better. Nobody should be left to suffer. So trauma-informed support for all, working with a trauma-informed perspective is so important for everyone in society. As therapy evolves and we learn more about the depths of trauma and how it has a profound effect on everyone, intergenerationally and vicariously. And alternative and complementary treatments are a great way to aid healing, as complementary treatments that offer extra care for many different conditions, taking the strain and financial burden from the NHS. So again, if we continue to be stuck beneath this negativity, we are going to out-resource ourselves, because it's all connected, and the sooner we heal, the better we get. And if we encourage people to learn how to heal themselves and to help others heal, we are aiding so many different levels. We are in a living crisis right now, and a lot of this is like a knock-on effect. It's like a negative cycle. Ultimately, I truly believe that we have to connect and we have to learn how to help ourselves and help each other. And that's what I'm trying to teach. And the more people that know this inside of societies, inside of communities, we are building a better foundation. We are more equipped to be able to help. We understand what to do before it becomes a crisis. I work with people with pain, trauma, addiction, phobias, irrational repetitive behaviours, emotional blockages and limiting beliefs. All of these things are greatly connected, and they really can contribute to symptoms such as skin conditions, weight management, depression, self-esteem, exam stress, fibromyalgia and ME, IBS, performance enhancement, sleep problems, and it can also be to do with habits like smoking. And once we get on top of helping people manage and deal with themselves on a stress level, sometimes, and a lot of the time, it can be a great extra level of support and help, so that even if they're in long-term or chronic situations, every little bit helps. Okay, so always go to your GP, always take the medication you've been prescribed, but there is other things that you can add on to this. There are other things that you can learn to help you heal, to give you ways to cope, and ultimately to share with others, so we create a better community and we prevent traumas from escalating and reoccurring. So my therapy journey, therapy is not just a job for me, it's a way of life and I love it. And the more I learn, the more I heal, and it gives me great pleasure to be able to teach and share everything I learn with others. And I believe in making therapy accessible for all, and think this is fundamentally important in all areas of the community. So what I want from my clients, I want safety, I want trustworthiness, I want collaboration, I want choice, and I want empowerment. I want to be an advocate for positive change. I want you to realise the power of your subconscious mind, practically and spiritually, whatever your background or culture or belief systems. I want to give you a solid foundation. I want you to become a confident communicator. I want to simply be the guide to help you find yourself safely, positively and enjoyably. Therapy for all is what I believe. Connection, building bridges within communities, positive self-talk, addressing that inner dialogue, simple to understand treatment plans that you have a choice in. I'm solution focused with all of my objectives. I want to educate because knowledge is power. I want to depathologise because at the end of the day, you are not your diagnosis. We are all human beings and we all have an opportunity to heal, and we can do so. So what I'm passionate about helping others, especially those that feel lost and alone. I want to be a beacon of hope and light at the end of the tunnel because I know that you can do this. I want to build strength in a community. I want kindness, I want connection, I want compassion. I want to encourage unique personal growth and the beauty of diversity, you being you. My inspirations as therapists are people such as Lisa Ferrance and Janina Fisher. They're amazing psychotherapists that have been practicing since the 1980s. I do a lot of their courses, a lot of their studies, and I read a lot of their books, and they're so really inspirational for me. So who do I represent? I represent the people. I represent all imperfections. I want everyone to know how important and special they are, and especially those who've always felt like the odd one out. If you feel lost or lonely or low, I want to be the one for you. I want to represent the minority, and ultimately I want equality for all. No one is any better than anyone else. And so what do I want to achieve? Well, I want to reinstall hope. I want you to build a good relationship with yourself, which is different for everybody. I want to bring you resolutions. I want to help you resolve and build a resilience. And I feel everyone has the right to be safe and happy. And I want to create a trauma-informed culture with a holistic approach to healing and therapy. As I mentioned before, I want to bring this into schools, into the workplace. I want everybody to know and everybody to feel that they have the ability to cope and the ability to heal. So what therapy means to me? Well, therapy is my life. Okay, it's the greatest gift to be able to guide and support people to heal themselves and really reinforce that mind, body, soul connection. So my code of ethics, I work as an independent therapist, so my code of ethics is highly important to me in everything that I do. And I've included an outline in this presentation as part of introducing compassionate therapy and how I work. So professionalism, I set clear boundaries, I have total respect for my clients, and I have a duty of care. So as I've mentioned before, you feeling safe, going at your pace, that is my priority. Confidentiality, I want to build trust and rapport. I want you to feel safe and secure. I have a legal obligation. Anything you tell me is completely confidential. Your privacy is utmost important to me, and I will only disclose any information if there's a high risk of harm to yourself or others, or in the case of safeguarding children or vulnerable young adults. Competency, I only work within my qualifications and trained ability, and I'm always continuing my continued professional development, taking on new training, webinars, and keeping up to date with all my policies and procedures. Informed consent, I won't do anything without your permission, and I'll provide you and discuss with you all of your options and choices. This is a collaborative experience, and unless we work together, there are limitations on that. I will always ask questions and ask for your feedback. I think it's really important as a therapeutic alliance, and you can be totally open and honest with me. You are the client, I'm the therapist, you're not going to hurt my feelings. I want you to have an enjoyable experience and one that you really get a lot out of. And I always include all of this in all of my interventions. On an advertising level, I'm very ethical, I'm always honest and transparent with everything that I offer. Supervision, I have regular monitoring and consultations with my own supervisor, and I do lots of self-reflection and self-care. The only time I may ever need to discuss anything regarding your case would be simply as a case study, and I'd only use this as a training tool. Safeguarding, I'm up to date with all the government guidelines and policies. I always get parental or guardian consent for minors. I'm constantly identifying potential risks. I'm keeping clear communication. Everything I record is accurate and up to date. And my main outlook is for protection of children and vulnerable adults. I carry out regular risk assessments. These can be in line with self-harm, suicide, substance misuse, violence, neglect, medical and mental health disorders. Although I'm not qualified to diagnose, I will always recommend GP referrals, and I'm looking out for hidden unresolved traumas. And I have a legal obligation to protect you in this way, and if I have any concerns, even if it is financial, social or cultural, I will give you all the advice and access to point in the right direction to access the help that you need. And finally, my complaints procedure. I always encourage my clients to come directly to me if they're not happy or satisfied. I really do connect. I offer feedback throughout all of my therapy sessions, making sure that you are happy at every stage along the way. Although if there is some sort of issue, I work closely with you to resolve that. I am fully insured, and if necessary, help you to seek legal advice. So thanks for watching this video. This is the first one from Compassionate Therapy, introduction to how I work. I'm going to make these weekly videos, and I hope they become a really great resource. If you have any questions or queries, please do comment or send me a message. I'll do my best to answer. And if you want to help promote the channel, you can subscribe and you can turn on the notification bell for when I upload new videos. So thank you for watching, thank you for your time, and I look forward to connecting with you in the future.